If you have been told your tests are normal, but every time you eat, you feel pain, nausea, or bloating, your gallbladder may be ruining your life, and no one told you because they were looking for stones instead of function. So, what the gallbladder really does? The gallbladder is not storage. It is a pressure regulated pump that releases bile precisely when fat enters the intestine. No bile, no fat digestion. So, why gallbladder pain happens? Pain is not infection, pain is pressure. When bile cannot exit, gallbladder contracts, outlet spasm, pressure rises, severe pain occurs. Labs can be perfectly normal. And the reason is the cystic duct, what you call bottleneck. The cystic duct is narrow, twisted, and prone to spasm. A stone does not need to stay stuck all the time. A temporary blockage will give you severe pain. When you have the resolution, normal imaging will be there. That's why ultrasound miss it. So, why pain comes in waves? It's because the gallbladder contracts rhythmically. Pain builds, peaks, then fades. This pattern is diagnostic. So, what are the classic symptoms? Right upper abdominal pain, pain under the ribs, pain going to the back or the right shoulder blade, nausea after meals, bloating after fatty food, attack lasting 30 minutes to an hour. Many patients would say, I feel sick after eating, not while eating. That timing matters. Why fat triggers symptoms? Fat, as we said, requires bile. Without proper release, fat sits indigested. Intestines spasm, pressure increases. It's not a food intolerance, it's missing bile. Why it's misdiagnosed and often labeled as a reflux, IBS, anxiety, or gastritis. This is the key difference. IBS, inflammatory bowel syndrome, improves after bowel movement. Gallbladder pain does not. So why the pain is referred to the shoulder? The gallbladder shares nerve roots with the shoulders between C3 and C5. That's technical. The brain misreads the signals. That's not muscle pain. It's a referred pain. Why imaging and labs look normal? Ultrasound and CT show structure. They do not measure emptying, pressure, contraction strength. That requires the test we call HIDA scan. So what's HIDA scan? HIDA scan will measure the ejection fraction, and it should be between 35 and 75%. If it's too low, weak contraction. If it's too high, hyperkinetic spasm. Both cause pain. One word about the estrogen and the weight loss risk. Estrogen increases cholesterol in bile and reduces motility. The risk increases with pregnancy, birth control, premenopause, rapid weight loss, GLP-1 medication, highly relevant today. Antacid don't work. And why is that? Because acid isn't the problem, bile flow is. So what happens after surgery when gallbladder is truly the problem? Pain resolves, food tolerance returns, quality of life improves. I want you to remember this. Gallbladder disease is a plumbing a problem, not a lab a problem. If eating has become something you fear, that's not normal digestion. And if you are told your gallbladder is fine because imaging was normal, it may be time to test function, not appearance. Very, very important. This is Dr. BenMaamer. If you believe healthcare in America needs to change, hit follow.